email us, or connect with us on social media.
Super Channel Entertainment Network. Go get what you want.
Your heart is singing out through the clouds. Go get what you want. Go get what you want. No fear of letting go. Let me ever glow. Go get what you want. Go get what you want.
Series, documentaries, esports, movies. Super Channel Entertainment Network.
You're watching Rogers TV.
Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest today to the show, I'd like to share a few thoughts with you. For those of you who watch the show regularly, you know I like to kind of give an update on COVID-19 and the impact on Grey Bruce. So today, there continues to be good news. The provincial stay-at-home order has been lifted, and we are now in step one of the province's roadmap to reopen. However, restrictions continue to apply. The vaccine rollout continues in many locations, including vaccine clinics, pharmacies, facilities, and in the homes of those who require the service. We have now surpassed 121,415 doses administered in Grey and Bruce. The Grey Bruce Health Unit confirms that the Delta variant present in Grey Bruce is a variant of concern as it is more transmissible. Both first and two-dose vaccinations are effective in reducing the hospitalization rates from the Delta variant. The Public Health Unit could not have done this without the support of the community, and they need us to continue the good work. Please stay the course by following the 3 W's and the 2 A's advised by the Grey Bruce Health Unit. Wash your hands frequently, watch your distance, ideally 6 feet, and wear a face covering correctly. Avoid crowds and arrange for outdoor activities whenever possible. This journey has been long, and we are all very, very weary. Continuing to remain vigilant will bring all of us closer to the finish line and the end result of reopening Grey Bruce and Ontario. Let's continue to keep up the effort to make this difference together. I want to thank all of you in the community for all that you have done to help us move through COVID-19 pandemic. And on that note, I want to thank and welcome my guest today. Jeremy Woodley from Woodley Care Services is here to talk to us about Woodley Care Services and the impact of COVID-19 on the services that he provides. Jeremy, thank you for joining us today.
Hi, Carol. Great to be here.
Can you tell us a little bit about yourself, your profession, and also about Woodley Care Services?
Sure. Well, I've been a personal support worker for 17 years now. Time's going by pretty quick. And I've been in business 7 years this month now.
Wow.
Yeah, it's I can remember it all like it was just yesterday. And anyways, well, the impact when COVID first hit us last year, I was very thankful to be considered an essential business, so I didn't have to close. Business did take a hit, though. I lost 3 clients, and just only due to nobody knew what we were up against. So.
Yeah. Now, Jeremy, tell me a little bit about. You say you're a personal care support worker. Now, you travel all over Grey Bruce, correct?
Correct.
And what sorts of, are you in facilities, homes? Where do you provide the services and how do people get in touch with you if they need this?
Okay. Mostly I'm in people's homes. There
Mhm.
are occasional times where like Seasons or Central Place need to call me for families need extra private help.
Mhm.
Sometimes they need extras more than their retirement homes can provide.
Yeah.
But mostly it's in people's homes or out in the community.
Yeah.
And yeah, we're just right now we're relaunching things. I've been in business 7 years, so I was able to stay open. But last summer things started to pick up, and things have gradually gotten steadier. And now I've got clients in Miller Lake. I've had inquiries in Chatsworth, Thornbury areas. Everybody wants to keep their loved ones at home. So
Yes.
myself and my staff are doing all we can to accommodate that. I've got bringing new staff aboard. There's a gentleman named Chris Evie Evans, formerly of known for the Evie Sports Bar. He has many years with respite autism behavioral management, so he's coming on board with me to partner with me to, and this will help so we can reach the special needs individuals and families with respite help and behavioral management if it's needed.
Yeah.
So that's been my background as seniors and special needs. So we're just bringing some new, well-experienced people aboard to really reach out to not just Owen Sound, but the entire Grey Bruce areas.
So you actually care for people across all ages then?
Yes, I do.
Yeah. Yeah. So you're into the facilities, but you're also in people's homes. Now, you've had to obviously adapt to COVID-19 and PPE and all that. How did that work for you? Did you have problems getting supplies at the beginning?
No, I was able to get supplies right away, and I
Yeah.
just loaded it up. And then for the longest time, I was the only one doing the work anyway. So in that regard, it was helpful.
Yeah.
And then once they were allowed to have more supplies, I was able to stock up on more. And
Yeah.
then I just had some new Woodley Care Services masks come up.
Excellent. Excellent. Yep.
So myself and staff can have. Um, and most of us have had our vaccinations. My second one's booked in July, so yeah. So we're doing all we can to follow the guidelines and keep people at home going into their homes.
Yeah. Yeah. So you had certainly mentioned some new programs. So the one you just mentioned about the autism support isn't a sort of a new program you're planning on developing.
Yes, yes. We feel that there's as much as there's a need to keep seniors at home, there are families who have special needs, kids and children, and they need to be out in the community, and the parents need a break.
Yeah.
So we want to be available to provide that for them.
So fill me in a little bit more about what respite service means, because you mentioned that you provide respite. So is that overnight respite? Is it daytime respite?
A mixture of both, depending on what the family needs. Sometimes there's been where you spend the night at their place with a family takes a mini getaway. There was just it gives basically respite is caregiver relief. It gives families and the main caregivers a chance to go reboot, recharge, go smell the roses somewhere. Well, now with things opening up, we hope to get them like watching movies and stuff, but at least out to the park outside doing stuff. It will help a lot more now with things slowly reopening, so we can go swimming, other outdoor activities.
Yeah. What have you noticed with your clients that you serve? I'm not sure if you call them clients or patients, Jeremy, but what have you noticed over the past year with the pandemic as far as you know the people that you see? Because you would have people on your care for a period of time. You get to know them really well.
Right. I noticed loneliness kicks in a lot. They can't see their families who are out of town. One particular family I support weekly up at the peninsula, they still haven't had their Christmas dinner.
Oh my.
I mean, we're halfway to Christmas this year. They still haven't had last year's Christmas. I would say loneliness is one big one because you can only do Zoom meetings so many times or phone calls. It's not quite the same as face to face. People are, and actually too, like people are, they're counting their blessings more too, because within a blink of an eye, you never know when you're going to hit a pandemic, and so everybody's still doing what they can to pull their weight to get us all out of this on the other side.
Yeah. Yeah.
And I really, really, truly believe people are going to want to pay to stay at home more than go to a home and stay at home as long as possible because at least you can go see your loved one at home more than you can like with some of the restrictions in nursing home, LTC, and retirement homes.
Yeah.
I really truly believe they're starting to really value the home life and family life more than maybe in the past. Not that they didn't value it, but maybe take it for granted.
Yeah. Certainly, people are concerned more about group living, for lack of a better term. So people wanting to stay in their own homes may actually increase the demand for your services.
Right.
Which is good for business.
It is good for business. And I think too, like just recently I lost one of my dear clients, and he really wanted to go in his own home, and he did.
Yeah, yeah. So he had his wish come true. Yeah, yeah. So we hear about the shortage of personal support workers, and there seems to be a big demand in facilities for PSWs. Are you concerned that as your business grows, you may have a challenge, or do you find that, what are you thinking as things change for you?
There was a slight concern, for sure. There was a shortage. I guess that's why I'm being bombarded with a lot of inquiries lately, because there is a shortage. But I think the whole industry is short, and I think maybe the more the government steps in and not so much ups the ante financially, it's the working conditions within the facilities. But I also do, in a way, it could be helpful for me because people are more preferring to work in home care than they are the facilities, anyways. So that's a good sign. But they may turn around and find a new job at a different profession altogether. And you'd hate to lose good, loving, quality, competent people to different, all because of working conditions.
Yeah. I've often said that the PSWs are the glue that holds everything together because you deal with the everyday needs, the everyday life situations for patients, whether it's in the home or in facilities. And they certainly have been the unsung heroes in this pandemic, without a doubt, for what they've been willing to do.
Right. And I think going forward, I think people are realizing that PSWs are really the unsung heroes, and you're starting to see more appreciation for us now.
Yes. So in your business, are you all PSWs, or do you have other categories of people working with you?
Well, mostly PSWs. I've got a couple nurses coming aboard, and of course my buddy there, who's he's an EA, but he's got his background with respite autism and behavioral management. So there is a good variety there.
Yeah. So you're bringing.
My wife's an EA, but she helps me with some of my clients as well.
Yeah. So you're bringing nurses on board. What sorts of things will they be doing?
So they will help with a lot of the day-to-day work, and once in a while you get those all for like say if somebody's diabetic that need insulin. I've got a foot care nurse friend that can help with the foot care, and anything from like the wound dressings, any type of nursing care that PSWs aren't legally allowed to do, the nurses can come in and help with that.
Yeah. So it expands the service that you're able to provide to people.
Right.
Yeah.
Hey, absolutely. Because in that way, the care you would get in a facility, we could bring it to you right at home.
Yeah. Yeah. Now, do I recall correctly that pre-pandemic, when we chatted, you would actually take people to appointments. Is that correct? Did I
Yes,
remember that correct?
I still do that.
Okay, so it's not just care in the home. You actually provide transportation and you're with individuals when they go to see their healthcare provider, doctor, nurse
Yes, I
practitioner.
do.
Tell me how that's worked in the pandemic because things have changed so much.
Right. Well, like a year ago, yeah, there was hardly any calls for that, but lately, I think there was one last summer I took somebody to the hospital, and I was hired to take a friend of mine's grandparents a couple of times to their medical appointments. Uh, I've been getting calls to go back to Toronto and London again, so I think now we're a year into the pandemic. We've survived a couple lockdowns. More and more people, like if numbers continue to go down and vaccinations go up and everybody still does their part, more and more are going to start to inquire about that again. Because I know at first everybody was like on hold and nobody wanted to go near a hospital for a while there.
Yeah.
But
Yeah. And that's so I want to talk to you a little bit about your travel, and then we'll talk about people avoiding hospitals. So, with the hospitals starting to open up and hopefully opening up things like surgeries,
Right.
you're anticipating you will be asked to take people past Grey Bruce into other places.
yes,
Yeah.
yeah. Before I used to get asked quite often to drive to London.
Yeah. Yeah.
And I could see that coming again. Actually, just yesterday, I received an email asking for a ride to the airport.
Really?
Yeah, so I think now that things are opening up more, everybody's going to be
Yeah.
more willing to bring home care, and they'll be looking for rides as well.
Yeah. One of the things that I've heard with other interviews I've done is the concern about patients being reluctant to go to hospitals during the pandemic, and you mentioned that.
Right.
Can you talk a little more about that and what you noticed as far as the patient's health during pandemic, whether it was mental health or physical changes?
Yeah, I noticed in some cases there was a decline in the deterioration with some. And then there were others that were doing the best they could with what they had to overcome it as well.
Yeah.
But, as much as we have to be concerned with the virus, there were other health factors due to COVID at play here.
Yeah. Yeah. Doctors have been doing, and nurse practitioners have been doing Zoom calls to do health or wellness checks. Were you ever involved if a patient wanted to speak to their doctor? Did you participate in those calls at all?
To this point, no, I have not been asked to.
Yeah. Yeah. It's mostly the patient.
It's usually the family that does.
Yeah. Yeah. Yeah.
Not sad that I wouldn't, but to this point, no, I haven't been asked.
Yeah. And it's just interesting to know. I'm amazed at how comfortable people are getting with the technology.
Right.
Yeah. Wouldn't have expected that 8 months ago.
Well, no, this is the first time I've had Skype, and it's been around for a few years.
Well, there you go. So this interview is your first Skype experience.
Yes, it is. Yeah,
There you go. Good, good.
I've done
Well,
lots of Zoom, but first Skype.
yeah.
Um,
So tell me a little bit more about your services and what you'd like the viewing audience to know about you.
Yeah, so the services, care services provide, we help with in-home support. So that's your bathing, personal grooming, help in getting dressed. We help with showers. We help with homemaking, which is some meals, some light cleaning, rides to appointments, your errands. There's a couple I've had for 3 years now. They get morning care, but we do their laundry and shopping weekly. So we do all that. Of course, respite relief, and that's a companionship. And we're launching into with all the seniors and the special needs individuals.
Yeah.
And
So
And
that's
then
good.
things we can think of, we'll add them as we go along.
You know, I've heard that businesses pivot and adapt, and healthcare, from what you're describing, is absolutely pivoting and adapting to the changing needs, without a doubt. The people that you see, you've described taking care of people over a period of time. So you develop a relationship with these patients.
Right. No,
Yeah.
absolutely. No, they
Yeah.
become like family to you after a while.
Yeah, you get to know them well. Uh, I would imagine that family members who live far away would also be grateful for the services you provide. Can you talk a little bit about what you're hearing from family members who can't get up either because of the pandemic or distance? What are they saying to you, and do they ever hire your services for their loved ones?
Yes, as a matter of fact, I received a testimonial earlier this week. Um, the lady, I believe it, they're in Toronto. And, their parents live in a local retirement home, and they like the fact I was able to bring them somebody immediately, and the staff that goes in and supports them, they did nothing but rave about her. They like her personality, her professionalism. She makes sure everything is safe, everything's clean afterwards. And the staff, she's got the gift of gab, so she's really sociable and chatty, and they love that.
Yeah.
So it was nice to hear, as much as I like to have testimonies about how I'm doing and the business is doing, it is so awesome to hear when people are saying, hey, you sent me a great staff and they're awesome. Because then people read that and they say, okay, he does got great quality people that are competent, caring, thorough, do the job.
Yeah. And that,
And you really want to make a difference in their life.
yeah, yeah, and that gives families peace of mind as well. Um, we've heard stories about how concerned family members are about their senior parents and how they're coping at home. So, what would you describe as some of the most memorable successes that you've experienced? Certainly, even just in the 7 years, but over the pandemic as well.
Over the pandemic, I would say even my friend I just recently lost. Like we were planning a Tobermory trip, and we started to get him outside to like the park and the bay shore, and he loved it. And I think even though we never got a road trip in, just the fact that he just really wanted to stay at home, and he got to. I mean,
Yeah.
that speaks volumes. He just wanted to stay home. If you're gonna go, you might as well go at peace in your own home.
Yeah.
There's other successes. I would say one fellow we had in between lockdowns, an autistic individual, just how we come out of his shell, and he loved being with us weekly outside and doing board games and lunches together. And I'm also seeing ones that their mobility is improved with us helping them with their exercises, their walking.
Yeah. Yeah.
Yeah,
So lots of success stories.
there really has been.
So when you provide this service in the homes and retirement homes, but specifically in the homes, what other professionals do you find that you have to communicate with around the care? If someone has more than one condition.
So care partners for sure.
So nursing.
Yeah, so certainly nursing, physio and occupational therapist.
Yeah.
With one fellow who needs a lot of physio, sometimes you have to coordinate back and forth to make sure that the exercises are done right and he's getting them in.
Yeah.
Let them know when he's not.
So you're the eyes. You're the eyes in the home.
Right.
So you
Yeah, so-
actually, your PSWs also perform the exercises and try and keep people mobile.
Right. Yeah. I mean, as long as there's a physio, we can't do the physio ourselves, but at least if there's a list of exercises, we can make sure they're doing them and guide them
Yeah.
along.
Yeah, yeah, yeah. What do you think will happen as things reopen, as far as the services you provide? What do you anticipate over the next year? Hard to have a crystal ball, I know, but
Right. Yeah, no, I actually do anticipate there'll be a lot more home care inquiries. I really do believe, given like when there was, even when families had to take someone to a retirement home or an LTC home, you have to wait 2 weeks before you can see them again. And in some cases, you couldn't go and see them. My step grandmother, well, my stepmom, like this is in Brantford. For over a year, my stepmom never missed a visit with her. Then the pandemic happened and she could only seen her 2 or 3 times by the window. And then she passed in February. And then the rest of the time it was just via phone call. So I really do believe there will be more of a need for in-home supports. And as things open up, I think more and more people will start to, they'll really want to get out more and take those many, like, so if somebody has a autistic in the child, for example, you can see them leaving them in our care so they can go get that respite relief to take a mini getaway to Toronto or Niagara Falls or an overnight bed and breakfast or whatever the case may be. But just to have that break and knowing that their loved one is going to be cared for, supported, they can come back and feel refreshed and rejuvenated.
Yeah.
And I think people will respect the parents' wishes. If they want to stay at home, I really do believe families will do all they can to accommodate that.
that's certainly a bit of a mindset change, I think, for families, where before it was, their concept was, well, they'd be in a retirement home or a long-term care, someone can keep their eyes on them and keep them safe. And what you're saying is that may change as a result of the pandemic.
Yeah, absolutely.
Yeah, yeah. So do people usually book with you, for just one visit, a whole bunch of visits, months? Like how would people know how even to schedule with you?
Each case is different.
Okay.
So I think in some cases they go by the need. So if they know right away they need everyday help or multiple times a week, then we arrange that. Sometimes they already know they only need like an hour to once a week. And sometimes we kind of start small. Then if we have to add to it, then we do.
Yeah, yeah. So it just based on their particular needs for sure.
Yeah.
What haven't I asked you? We have about a minute and a half in the program. The time's gone by so fast. What haven't I asked you that you would like our viewing audience to know?
I think we've covered pretty well everything. But yeah, we do cover. I'm in Owen Sound, but we do cover all of Grey Bruce. So I'll go as far as Tobermory, Collywood, Mount Forest, Kincardine, and every city, town, village in between.
Yeah.
And care for all ages.
Yeah. And if people are just even wondering about the services, they can just call you and talk to you about it, right? They can have a conversation just to ask their questions. Jeremy, I've really appreciated you taking the time to talk to us about yourself and the services you provide. As we move through the pandemic, it will be interesting to see how we can support people in their homes. So thank you for being on the program.
You're welcome. It was great to be here, Carol.
Thank you. And thank you to our viewing audience for joining us today. Please join us again to learn more about programs, resources, and services available to you and to your family. Take care, stay safe, care for each other. Thank you.